Hello viewers, in this video I am going to demonstrate the common invasive, medical, therapeutic and diagnostic procedures performed through the thoracic wall. As visible, the first procedure in this video is tube thoracotomy. The common indications for this procedure are hemothorax, hydrothorax, chylothorax, pneumothorax and hemopneumothorax. As visible in this part of the clip, the model shows a tube which has been inserted into the intercostal space. Commonly, it is inserted into the fifth intercostal space, slightly into the mid-axillary line, but it may be inserted into the sixth space in case of hemothorax or empyema, or it may be upward in fourth space in pneumothorax. At these points, muscle bulk is less, so it is easy to pass the intercostal tube. Now you will see thoracocentesis. The question is, what is thoracocentesis and why is it done? Thoracocentesis is a procedure to remove fluid around the lung. It is done in conditions such as pleural effusion, infection, bleeding, collapsed lung, and cancer. To start with, usually an imaging test is done to look at how much fluid is around the lungs. This may be a chest radiograph, a chest ultrasound, or a chest CT to evaluate the location and quantity of the PF or pleural fluid. The skin of the puncture site is cleaned with a disinfectant before the needle is inserted. A local numbing medicine anesthetic is injected into the skin. The fluid may drain through the needle, or the doctor may slide a small plastic tube over the needle to drain the fluid. After the removal of the fluid, the needle and the tube are removed and a bandage is placed over the insertion site wound. The wound closes on its own without the need for stitches. Now we will discuss intercostal nerve block. Intercostal nerves are located under each rib. The intercostal nerves innervate the major parts of skin and musculature of chest and abdominal wall. Intercostal nerve block, abbreviated as INCB, is a nerve block which temporarily or permanently interrupts the flow of signals along an intercostal nerve, usually performed to relieve pain. Intercostal nerve block is used in variety of acute and chronic pain conditions affecting thorax and upper abdomen, including breast and chest wall surgeries. It also helps relieve pain in the chest area caused by a herpes zoster infection or shingles. The intercostal nerve block is generally performed transcutaneously at the level of the posterior axillary line. The needle is inserted until a bone contact with the rib is obtained. It is then partially withdrawn, reoriented caudally, and advanced less than 0.5 cm deeper than the bone contact. The use of a stimulating needle is connected to a peripheral nerve stimulator may be helpful. Eliciting intercostal muscle contractions indicates adequate needle location. Usually, it is preferable to block two proximal and two distal adjacent nerves to the selected level simultaneously to cover all the areas affected by the surgical incision. Then, after that, 15 to 20 milliliters of 1.5% of xylocaine is injected. Use X-ray guidance to insert a second needle and inject a steroid pain medications. Thank you guys for watching this video. I hope you have understood the thoracic wall procedures well.